Hey guys, I wanted to have a conversation today about interstitial cystitis. And if I look like I am panting, um, I do have an issue going on right now with my lungs, so I'm out of breath just sitting here. So I have not been running a marathon or anything. It's just me at the moment. Interstitial cystitis. If you don't know what it is sometimes called painful bladder syndrome. And painful bladder syndrome is also a blanketed term. If you are not diagnosed with reproductive issues and pains, sometimes they just call any pain down there painful bladder. I have actual interstitial cystitis, which are the Hunter's lesions. They're ulcers on the lining of your bladder. So where your bladder is a very pretty light pink blushy color, mine, you can't see that color because all of the red dots, and the red dots are ulcers, just blanketed. There's no cure for it. You can kind of go into a remission if you take care of yourself, and there are certain treatments that you can do that will kind of throw you into a lull, but it can flare up at any time. So interstitial cystitis is about 200,000 new cases a year, and they're the majority are women, but there are a lot of men that get it. There's no real good number because so many doctors don't understand how to diagnose it. To actually be diagnosed with interstitial cystitis, you have to have a cystoscopy, which is a camera put through your urethra up into your bladder to look for those lesions. And I was diagnosed fairly young. I was 20. And a lot of people go undiagnosed because they either the biggest what is it called? Good God. The way you get diagnosed usually is because you have urinary tract infections over and over and over and over and over and over and over. I was getting 6, 8, 10 a year, and the doctors were like, wow, but I wasn't going to the same doctor. I was between 16 and 18 years old. I would go to the emergency room. I would go to, there's actually several emergency rooms that I would go to. My doctor, I would go there, and then when I had no insurance, I would just go to Planned Parenthood, and they'd be like, yeah, you have a urinary tract infection because with your body, even though I didn't have an infection, my white blood cell count was up higher because it was trying to combat the nastiness that was going on. So for years I was misdiagnosed with urinary tract infections. And when I was 23, I was at work one day, and I knew I had been battling a urinary tract infection, and I had to go to the bathroom. And when I did, basically pieces of my bladder were in the toilet, and that's a gentle way of putting it. I had voided big chunks of my actual bladder. And I walked out and I said, I have to go to the emergency room. I will see you all later. Tons of pain, a little bit of blood. And they took one look at me and said, this isn't a urinary tract infection. And I was like, well, sure it is. I get them all the time. And they're like, okay, you need to go elsewhere. I went to a urologist, and come to find out, I had actual IC. Well, it has been a long 10, 15 years of treatments and diet changes and complete lifestyle changes. there are so many different IC diet variations that you can do. It can be controlled-ish with your diet. Sometimes they say that exercise can relieve some of the pain in your general bladder pelvis area. You kind of have to do an elimination diet. There is no medication that will cure you. I do take Elmeron, and Elmeron is all it really is, and the best way to describe it is a Pepto-Bismol for your bladder. It is a little capsule, little white one, and you swallow it, and it makes the medication makes its way to your bladder, and it kind of coats the inside of your bladder. So for the rest of my life, I take 2 pills a day, and I hope that it doesn't stop working. I did take it years ago, and I took 3 pills a day, and it made me so sick that I stopped taking it. It made me really, really sick. The only side effect that I have at the moment is a bit of weight gain, which is one of the side effects. That's really annoying. But so back to when you're first diagnosed, they have you go on an elimination diet. You basically stop eating everything under the sun, and then you bring on certain things and figure out if that's a trigger for you. A trigger for me is artificial sweetener. And you can be like, oh, I just tasted this and it's kind of funny. I know there's artificial sweetener in it. I can tell because I'll have something that has artificial sweetener in it and you may not can taste it, but within 24 hours, my bladder's telling me whatever you did yesterday was the wrong thing to do. So we stay away from all artificial sweeteners because that is a major, major trigger for me. And I'll have your bladder will constrict. You can have intense cramping from that. Urinary tract infection symptoms. It's basically, a lot of times it's like having a UTI 24 hours a day, 7 days a week. You just kind of forget what a normal bladder feels like. It's just, that's gone. At the moment, I'm good. I do know that along with artificial sweetener, any citric acid, if a gum has it in it, I'm going to know and have a problem. Caffeine in any way, shape, or form, carbonated beverages, any acidic foods. This can be tomatoes, it can be something canned, it can be obviously citrus, but any acidic food. I have a pretty boring diet because of this, and I really don't eat out very often because of it. But I do allow myself a few things, and I know that they're not good for me, but you can't remove everything in your life and expect to live a full, happy life. Maybe you can, but I certainly can't. One of those things is coffee. I'm a coffee drinker, and I can't handle physically going without coffee. And so that's kind of my one thing that I allow myself, that I know this is going to have an effect on me, but the effect is not as bad as the lack of coffee. The other thing that triggers is chocolate. Luckily, I'm not a big chocolate eater, but when I do, I just bite the bullet and I say, okay, this is going to hurt tomorrow, but I do need a little bit of chocolate. Not a whole lot is known about IC. They don't know what causes it. It doesn't seem to be hereditary, but because so many people get it, they can't label it as hereditary, I guess. And unfortunately, a lot of men get it, and there's like nothing out there for them. No one even talks about them. Along with the diet change and the Elmeron, I think there's 2 medications out They do give you an antihistamine as well. For a long time, they just said take Benadryl. Well, that kills me. It puts me to sleep. But the antihistamine also does something to counteract the stuff in the bladder, which is really strange how that all happens. But one of the other, I say, new age treatments is pelvic floor therapy. If you are interested in the pelvic floor therapy, research it. Okay, so I went to my doctor in January, and I was like, okay, this is what's going on. We've been through this before. I'm in a lot of pain. What do I do? And to get completely candid with you, and if you're squeamish, just turn this off. Several years ago, I had to stop using tampons because they don't go in, to be perfectly frank. And the reason is, with the painful bladder syndrome, everything constricts. So everything down there, my urethra, just everything that's down there is just in a knot and very, very tight. And tampons weren't happening. And I breastfed my son for 2 years, and I didn't get a period. So recently I started getting a period again. And I went to him and I said, look, I don't know what to do. Yeah, I hate wearing pads, but I can't wear tampons anymore. And he's like, okay. But you go to the urologist, they're going to do an internal exam. And I grew up, I'm a pastor's kid, and I grew up, and not that area is taboo, but I have to be in the right mindset to go to the gynecologist. I have to psych myself up and say, okay, we're going to go. They're going to do an internal exam. It's going to hurt me a lot. I called specifically and asked the urologist office if they were going to have to do an internal exam, and they told me no. So I was like, oh, good, I'm good to go. Well, I get there, and he's like, yeah, you need to take off all your clothes. And immediately I was like, if you have that anxiety, then you know what I'm talking about. If you don't have the anxiety, you're going to be like, what is your problem? My body shuts down. I can't let just someone in. And what he needed to do was he needed to get inside and feel my pelvic floor while pushing on my outside. So he needed both hands. And it's all technical, and I know it's all routine, but it's wildly uncomfortable, and it's just wildly degrading because you're in that position and you're naked, and some man you don't know is about to try to shove his arm up you, and it's really uncomfortable. And it's the reason I called and asked. I just wanted to be prepared when I wasn't. So I was already having a bad day. And he said, okay, you know what? You're really, really a good candidate for pelvic floor therapy. And I was like, well, I'm not 100% on what that is. When I look it up online, because I had done a little bit of research on it, there was no A, B, C, and D. You walk in, they do this, and then you go home. There was none of that. I couldn't find anything that said what actually took place once you got there. So I asked him, are they going to do an internal exam? And he said no. So I said, okay. Y'all, I walked into this office building, and it was like a shop. Like you walk in like you're going shopping in a strip mall type thing. And that's what I'm trying to say. And they had this new age music playing. They had a fountain going. They had incense burning, and I immediately was uncomfortable. Not my thing. I am a give me a pill, give me a shot, take care of it type person. I'm not holistic in any way. I am not, oh, essential oils will change your life. I'm not that person. So I'm already uncomfortable. And the ladies are really nice, and they waited forever. I hate it when you have an appointment and you still have to wait forever. So I asked the chick, I said, are you guys going to do an internal exam? Oh, you're going to love Dr. So-and-so. She's amazing. Everybody loves her. She's so great. And I'm like, that didn't answer my question. So she brings me back to a very dark room, and it looks like a hotel room. it looked like a hotel room. It was creepy. And she's like, just get comfortable, sit in this reclining chair, and we're going to chat. So we talked for a good 30 minutes about what my symptoms were and how, long I've had them and whatnot. She asked me a lot of questions about sex. And I'm like, okay, well, all right. Because, when you have IC, sex is painful. It's some people they just don't ever have intercourse with their husband because it's painful. And I was to that point. It's just everything I did hurt. Walking, laying down, sitting, and no matter what I did, I was in pain. So that's why I was there. Y'all, this chick that I've never met had me lay down, and it looked like a massage table because it had the face cut out, and it looked like a massage table. So she had me undress while she was in the room, lay down on the massage table, and then she wanted me to put my knees up. She got on the table with me, sat in between my legs, and expected me to get comfortable. She's like, just get comfortable. You're fine. Just relax. And I'm like, lady, you gotta be kidding me. So she goes to do an internal type exam. And, as a woman, you're used to them just getting in and getting out. Like, it's real quick. They know what they're doing. They do what they need to do, and it's done. She started off by literally putting just her finger, like at the tip of her finger, and it took 30 minutes for her to get in and get out, and it was just this. It was very uncomfortable. It was very degrading. When she left, I cried because it was just so degrading and uncomfortable, and it was a situation that I should have never been in. No one had warned me that this was going to get creepy. I thought, honestly, that what I was there for was for them to tell me, okay, this kind of exercise will help open your pelvis up, which will help everything loosen. They didn't do that. This is what they wanted me to do. So she says, here's what we need you to do. You need to buy a vaginal dilator. It's an actual medical equipment. It's medical equipment. And she said, you have to lay down for a half an hour every day by yourself in a relaxing environment and put this inside you and just hold it there. First of all, that's not going to happen. Second of all, I'm a mother to a toddler. Where do you think? You know what she said to me? Well, while he's taking a nap, you can lay next to him and do it. No. So this is, and I have actually never opened this package. We're going to open it right now. I know what it looks like because she showed me one that had not, that was a tester. It was there just to show people. This is an extra small, latex free. This is what she wanted me to put inside my body. It's very hard, very rigid. It looks like a glue stick. After this video, I can throw this away because it'll never get used. There are people out there who may very well benefit, and she told me a couple of stories about people who really, after a year of this garbage, were so much better. But you have to come every week for 6 months before you see any change. And I said, you know what? Have a nice day. I went home. I actually had to go to work afterwards, and I cried the whole way to work. Called my husband, I cried. I said that was the most degrading, uncomfortable situation that anyone could have ever been in. It was just really scary and uncomfortable. So anyway, I'm done talking about that. I am going to throw this weird thing away, but if you're looking into the pelvic floor therapy, look really closely. Matter of fact, if you want to, you can comment here, and I'll get your information, and I'm more than happy to email you, because I'll tell you all about what actually happened while we were there. I didn't like it at all, and it just was really, really scary. So at the moment, I'm doing pretty good. I do take the Elmron twice a day. I do currently, I don't do any acid except for my coffee, and my daily pain is doing pretty good at going away. But it usually does that for 4 or 5 months, and then it'll come back. I do have a urology appointment the 10th of this month, so we'll see. He's going to be mad that I quit going. I only went to the one therapy session, and I'm going to tell him straight up what he needs to inform his patients what's going to happen, because that's unacceptable. It's creepy and scary. So if you have an interesting IC horror story, go ahead and comment below. I would love to hear it. We are out there. You're not the only one. You're not the only one in constant pain. This is a chronic pain situation, and there's nothing that they can give you. Years ago, they gave you Darvocet, which now if you watch TV, there's like this big whole uproar over Darvocet. But I used to pop that like candy. I just realized, you know what? This is chronic pain. Nothing else is going to touch it. Change your diet and deal with it. So leave me in the comments below how you handled it, or if you're newly diagnosed, and if you have questions. The IC world is more than happy to swoop in and help you answer them. But I'm so sorry, this is a 22-minute video, but I just really, really have it on my chest. I just weighed heavily. And I don't want people to go through what I went through at the therapy. Now, if you have had the pelvic floor therapy and it worked, please comment, because those of us who it didn't work for, or we didn't let it work, we would love to hear those stories. So like and subscribe. I'm going to give updates about IC and new IC ideas and things like that. They won't all be 25 minutes long, but just updates here and there. So you are not the only one. We are out there. Have a great evening.